Let me just start with the word that's on everyone's mind, which is immigration. I want to start global because there is a phenomenon occurring across the globe about immigration, which has an effect on us down at the local level. Immigrants account for 10% of the developed world's population. So it's not just the US. It's been increasing since the 60s. It's been increasing in the US because of various laws that passed over the course of time, allowing immigrants, and I'm talking about legal immigrants, to come into the country. 200 million legal immigrants working around the world, another 10 to 15 million undocumented workers, 8 million Filipinos, 6 million Indians work abroad, and the world refugee crises are further diversifying that. So we have a lot of people who leave countries, go to other countries, send money back to those countries, and there's actually incentive systems in place for that. So just keep this in mind because this is one of the factors driving a change in the population. Now, let's talk about aging. And I'm almost 62. I'll be 62 this week. So I'm at the tail end of the boomer generation. So signs of global aging. Japan sells more adult diapers than baby diapers. That's an indication. Vancouver outlaws the use of doorknobs in all new construction, including private homes. Why? Yeah, so you can just get out if there's a fire or an emergency and you don't have to worry about using the doorknob. China is grappling with the 4-2-1 problem. Does anyone know what that is? Yeah, 1 child, 2 parents, 4 grandparents. 1 child taking care of 6 aging adults. Google launches a medical company, Calico, to defeat death by prolonging life. Have y'all heard of that? Okay. And here's where the math comes in. So we won't go too far into this, but basically, I'm going to talk in a few minutes about decreasing fertility, which is leading to the changing population. But this is the demographic transition model. You see on here birth rates, death rates, what's the natural increase. I'm going to talk a little bit in a minute about counties in North Carolina where more people are dying than are being born and more people are leaving than are coming in. And so this is just a natural progression, but where we are right now is a decrease in population. Okay. The world's population is aging. And I should also say that I have different years in some of the data because some of the data hasn't come out. So sometimes you'll see 2020, sometimes you'll see 2023, and that's just a lag in the reporting data. But global population share of children under the age of 5 versus those over 65, so those boomers, you can see the differences and then what the projection is going to be. 2100, the number of people 65 and older will be 5 times higher than the number of children under the age of 5. So we are an aging population. It's not just the US, it's across the developed countries. 2050, it's the number of people 65 and above are going to double the number under the age of 5. And then we're somewhere down here in the middle where we're starting that progression towards aging. Is global aging a problem? Yes. Now, you see Japan with the adult diapers up at the top. And you see on the left, the US down there, and you see the US kind of in the middle on the right-hand side. So we're not as old as Japan, South Korea, China, Germany, some of these other countries, but we're right there in the mix. Populations aging in many countries, there we are again, 65 plus as a percentage of the total population, 2020, and then what it's projected to be in 2060, you see with the US how that's going down towards that 30% line. So we're aging. Okay, why are we aging? The number one issue is declining global fertility. Not the number of babies born, but the number of births. And we look at it by age group. So we look at live births per woman, and then we have projections, and it doesn't take much to see that it's been in a decline and it's continuing to decline. And in the US, there's only one ethnic group that actually has replacement rate, which is 2.1. And we don't know what the 0.1 comes from, but it's 2.1. And most of the ethnic groups are below 2.1. So we're not replacing ourselves. And you saw that with China, where one child, 2 parents, 4 grandparents, they're not replacing themselves because they had a one-child policy for so long. So young children and older people as a percentage, just like I said, the blue graph is 65 and older. The red is under 5. Older is going up, younger is going down. World population with fertility below replacement, that's below that 2.1. You see how many countries this is affecting. Very few in 1965. We were still at that tail of the boomer generation. 2015, you see it comes up. By the time we get to 2050, it's going to be affecting at least 137 countries. Global fertility, here's another take so that you can look at the countries on here. You see the US is that 1 to 1.9 below replacement rate, which is 2.1. The countries that are above that are in Africa and Southeast Asia, where they have much younger populations. But for the G7, the G20 countries, they're all in that pink shade. Where have all the babies gone? Well, all the babies are being born on the African continent and Southeast Asia, and not many in other places. So ratio of children to elderly adults. Again, this is looking at 2005, look a little past, and then look towards 2050. And you see those ratios are 1 to 1 and starting to get worse than that. Changes in the median age of the population. Take a look at this. So if we look at North America, 2020, 38.4 was the median age. When we get to 2050, it'll be 43. If we looked at parts of North Carolina, like if we looked at east of Interstate 95, the median age is like 57. But if we took out the Hispanic population, if we look just at the Hispanic population, it'd be 34. So that's going to be important in a few minutes because certain ethnic groups are much younger than others. Proportion of population 60 plus years old. Again, you see up there North America. Again, we're aging. I'm just showing you data in different forms that show you how the world, North America, the US are getting older. Population average remaining years of life. Again, you see Japan, Western Europe, Eastern Europe, much older than we are. And I'll talk in a minute about age expectations because those are changing as well. Proportion of population with remaining life expectancy of 15 years or less. And then look at all the shading. Starting in 2000, we're mostly affected 2030 and on. But aging population, fewer years left, no children being born. These are the key things to think about. Snapshot of global aging for industrialized regions. Again, it looks pretty much the same. Everyone is below replacement rate, which is 2.1. Snapshot of global aging for developing regions. We have sub-Saharan Africa, which I just showed you above, North Africa, the Middle East, Central Asia. Everyone else is at or below replacement level. So when you think about migration, climate, weather conditions, and you see younger people moving, Africa, Southeast Asia, those are the areas most impacted by those changes, and those are also the younger populations. Now, So when Dr. Johnson and I talk about this, there's all this going on. We like to think about disruptive demographics on your left, a geographic redistribution based on age and changes that are taking place, browning and graying of America. I had my grays tinted so you can't see them. A slowing total growth, a loss of the white population, and I've got some data on that, declining fertility, decreasing male labor. So the number of men in the labor force at all ages has been decreasing for quite a while now. Premature deaths, opioid addiction, COVID, labor activism, and then we've got other disruptive forces, which are just other things in the universe we can't control. Climate change, COVID, decisions that come down that might affect fertility and birth rates even more. And so what we have, what Dr. Johnson and I call this is a new normal, certain uncertainty. We know some things are certain because we have the data, but then we have these disruptions that are affecting fertility and aging and the number of people on the planet that we really can't control. And so we monitor those. And what we like to say is there's a workforce out there. This is very important to the workforce. We're professors in a business school. And then there's all of us living in this community. So at the end, I'm going to talk a little bit about the iceberg, which is how you interact with people and start to think about characteristics we share that are below the iceberg instead of just what's above the iceberg. And this is how we can develop a sense of belonging, by focusing below that iceberg. So the US life expectancy at birth, I was born in 1962, and so the life expectancy was 69.7. By 2030, it's going to be 101. It's going to be the life expectancy. So children that are born then are going to be expected to live. Some people say that the person who lives to be 130 may have already been born. So our life expectancy is going up, great health care, better food, all of those issues. So we have an aging population that is aging and living longer. Now, I said something about the white population in Europe, in North America, and you saw how those countries are so much older. We took a look at it by state to see what was happening with the white population across the US. And North Carolina is over here in the middle, and we have a slight gain, there we are, 1.4. But you see most of the states in the US are losing their white population. There's very few, what is that? 5, 6, 7, 8, 10, less than 15 have a gain in white population. And that's because of people moving from state to state and different shifts in population across states. But all of those in the red are losing an older white population. Intermarriage in the US. Started tracking this in 1967. That number has been going up. It continues to go up. And when this is 2015 data, it hasn't been updated. I expect it's probably going to look similar, but you see the percentages: Hispanic white, Black white, non-white, Asian and white, and other would be mixed races. So in all of those categories, those percentages are increasing. Children are born. Those numbers of ethnicities are also increasing. Multiracial population is the most rapidly growing population. It increased 276% between 2010 and 2020. So in the US, we're at 33.8 million who identify as multiracial. Now, the overall population of North Carolina is also increasing. So we have it broken down in 10-year plus increments. So if you look back at 1990, who lived in North Carolina in 1990? Okay, so quite a few of you. So we were growing. We had started growing. The whole South had started growing at that point. And then you see kind of this rush, and then we get down here, and we are just have been exploding. Before the COVID-19 epidemic, we were gaining 385 people a day to the state. Most of those people were coming to Wake and Mecklenburg counties, almost half and half. But I'll show you in a few minutes how they then started to spread to the other counties around them. So the overall percent of population change, 2020 to 2023, North Carolina is still growing. The South is still growing. Most of the population change is occurring in the South. It's mainly a shifting of people moving from state to state. Fertility's down, so it's not babies being born, it's people moving around, and it's also the foreign population that's moving into the US. So I've got the percent natural change, migration. You see it's largely due to migration. So when we look at North Carolina, it's people moving here from other states, and then it's the foreign-born population moving, and then the native white population that was here prior to that time is aging. So all of that's driving the change in the population in terms of our physical appearance and our age. North Carolina's population change during this time period, again, it's as a result of migration from other states and then foreign population moving in. But there's our number, it was at 322 a day moving in, and it's still slowing down a bit after the COVID epidemic. But we're still pretty high. We're one of the top importer states in the US. So, and this is what it looks like. It used to be everybody came to Raleigh and Charlotte, and they were at the top. And then during COVID, it started spreading out to the counties that border Wake and Mecklenburg, Durham, Guilford, Cabarrus. You see it going down, Brunswick County, and it started picking up more counties. The reason for that is housing costs went up significantly in Wake and Mecklenburg, and people started moving out to find less expensive housing. Then that started happening in that second tier, Durham, Guilford, Cabarrus. People started moving out. When Durham became expensive, people started looking at some of those other counties. So we call these high growth counties and pole growth counties because more and more we have people spreading to those perimeter counties in the state. And this is what it looked like during COVID in terms of how people were moving into those pole counties. So what happens is we end up with our traditional growth magnets and our new growth magnets when people migrate into the state. And so you see Durham is one of those traditional growth magnets. Orange is not. Wake is. Johnston is. And then the new growth are those perimeter counties where people are moving to look for less expensive housing. And that's why Orange County is not colored in, because the housing is incredibly expensive in Orange County. But you see people starting to move north, Franklin County. Eventually, I think we'll see Granville and some of the other counties up above Durham start to pick up some of that growth. So people still move here, but Durham's not getting the same growth it did before COVID because people are starting to spread to some of those other counties. And if you want to know where they're coming from, the states in the country that are losing population, New York, Illinois, California, New Jersey, Louisiana, Massachusetts, Hawaii, Maryland, Connecticut, Kansas. And there's their numbers they're losing. And then the ones acquiring it, Florida, Arizona, North Carolina were third. Washington, Texas, it goes down. For a while, we were about 5th on that list, and during COVID and just after, we bumped up to number 3. So like we're looking at another congressional seat because of our growth, and then some of these other states are gonna lose it because of their lost population. And here's where they come from in a picture. So you see large numbers coming from the northeastern corridor, but then literally every single state for a while, every single state except one. Does someone see a state without a dot? Yep, that's the only state that didn't send us anyone. No idea why. So again, so we've got people moving in. What do they look like? They look white, black, Asian, Hispanic, elderly, native born, foreign born. Those are the numbers the South is acquiring in every single category. The Northeast and the Midwest are losing people in every category, and the West is still doing okay with the elderly. But the South is the place where everyone is moving. What about North Carolina? So I showed you where they're moving in the country, and here's what our foreign-born looks like. So back when I was born, 21,978, and now 824,000. Huge increase, and even greater now since 2018 of the foreign-born population growth. So again, our population growth, people moving here from other states, and then people moving here from other countries. Nativity, race, and ethnicity. Here are our numbers across the bottom. Obviously, the highest growth is the Hispanic population. Younger population, childbearing years, higher fertility than the white population, even the black population. Asian and foreign immigrants would be right after that. And then Pacific Islanders actually have replacement rate fertility showing up on that chart as well. So the babies that are being born are Hispanic, Asian, immigrant, Pacific Islander. When people move here from other states, it's not just their ethnicity or their age, it's also their income. When they move here, we look at this data that the IRS produces, and it basically is when someone files their income tax, it records where they are, and then the next year when they record their taxes, if there's a change in their address, we can look at that and see that when people move here by age, they all have higher incomes than the people who are living here. So what that means is people move here and they drive up the cost of housing because they have higher income levels, and the demand increases for higher level housing, which again is why people start moving to those other counties. So they move here and there's a demand for services, but they also come here with higher income levels. And that changes our composition in housing. Browning and graying. So again, our white population shifts in here. You see when we get down here to 2020, the white population, we were barely above on that line at 1.4, but we're losing our white population, and we're gaining in that Hispanic population, the Asian population, and then the other foreign-born. So you can see the numbers and the percentage change, and it's been a trend since 1990. And here it is by ethnicity from that period 2020 to 2023. And again, you can see on here that fast change in the Asian, Pacific Islander, Native Hawaiian, multiracial, Hispanic, while the white population is down at the bottom, just below American Indian.
Included in the Asian?
All Asian, Southeast Asian, all of Asia as defined by the census. excluding that Pacific Islander. These are just the categories that are in the Census Bureau. I would say I would expect they might change, but I'm not sure about that anymore. North Carolina population change by age, and this is that aging factor along with the Browning. You see the seniors 65 and older, growing, preschool, very small, school age, very small, working age, very small. So again, that graph we saw that the younger children, because of that fertility rate being compressed, not growing, whereas the senior population is growing rapidly. What is this? Has all sorts of concerns. This is basically looking at death rates by county in North Carolina. We have 100 counties. We have 34 counties that are in severe biological decline. Durham's not one of them. Most of them are in the Northeast or along the border with Virginia and South Carolina. Those are places where, again, that death rate is higher than the birth rate, and people leaving is higher than people coming in. So we have about 34 that are in a crisis in terms of that. And then places like Wake and Durham and Johnston, that light gray shading, those are places where they're biologically stable. So birth, death, in-migration, out-migration are pretty even. We look at this a lot because if you lived in one of those darker counties like Columbus or Edgecombe, as the population ages and people are on fixed incomes, they're paying for the services that support that county on fixed incomes. So that's where you would see issues with water and sewer and others that the tax rate supports. People are leaving and that burden becomes much greater on that over 65 population. So a lot of concern about those counties that are in that decline. They also are not in locations where they're going to get that growth from those high growth counties. So a question is, what are we going to do about those counties in the future? The COVID death rates by county almost match up with those counties in biological decline. They were the ones that had the higher death rates. Again, people are leaving, people aren't being born, hospitals closed, COVID pandemic hit, access to health care is limited. We had a lot more deaths in those counties than we did our high growth counties. I'm from Wilmington. There's one healthcare provider there, as opposed to this area where we have multiple healthcare providers. So that has a huge impact on how those counties are doing. The drug overdose, also a huge issue. Almost the same counties, slightly different. For a while, we had some of the highest rates of opioid deaths, but you can still see it's still affecting moderate high, extremely high, still affecting a huge portion of the state. And that's that intersection with especially the male population, not in the labor force because of opioid addiction issues. And this is emergency department visits by county based on opioid. Again, a huge percentage of the state being affected by that. I know I called the police for something, maybe about fireworks on the 4th of July, and I'm in Wake County, and they said, we'll deal with the fireworks after we get through the next 27 calls about opioid overdoses. So you see even Wake County colored in, huge issue. And then this is that natural population change. So those counties in green are the only counties in North Carolina out of 100 that have more births than deaths. And you see Durham colored in, Wake, our area, and then the rest of the state, more deaths than births. Again, that's that aging population. So very few counties doing well biologically by demographic standards. And here's that fertility rate, again, by the ethnicity of the mother. So I told you it's 2.1, and only one group is above that fertility rate, and that's Native Hawaiian, Pacific Islander, and that's a very small population group. So all of the others are below replacement rate, and white, non-Hispanic is very much below replacement rate. So a continued decline in fertility. And this just basically shows you that change in births by the age of the mother. And the reason this is relevant is because I mentioned that Hispanic population is much younger in the US and their fertility rate's higher. So we track it by the age, but overall you'll see that 20 to 24 and then the 30 to 34, the population's aging. You've got some shifts in the age of the moms in that group, but really that birth rate's being driven by the Hispanic population that's younger. And this is just another way of looking at that in terms of the total number of births. But you see the white and the change in the white birth rate as opposed to some of the other categories, just a hugely significant change. So again, as we think about ethnicity, we have a lot of changes taking place. And this does not show multiracial, which is that fast-growing category. So, why is the fertility rate so low? We've had increase in female participation in the labor force, but during COVID-19, I did focus groups across the state, and women told me they were quitting their jobs because the kids were at home. They were having to teach the kids at home because schools were closed. They were taking care of the household, trying to figure out. So we actually had some decline in the female labor force participation. We had a lot of involuntary retirements during that. We had people that involuntarily retired that only had $7,000 or $8,000 in their savings account. So we had a lot of shifts taking place during that period. And as you can imagine, the birth rate declined even more. When we get the population data, in a couple of years, there's going to be a huge hole where COVID-19 was. If you have a hurricane, you usually see an increase with births. With COVID-19, people were scared. They were losing their jobs. They were involuntarily laid off. And the birth rate, we're missing a huge composition of births during that COVID-19 period. And one of the other effects on the labor force, I think it's important to understand, is the loss of men in the labor force. And it's opioid epidemic, absolutely, but it also, you see it in college statistics. When I was at Carolina in '85, I was right about where those lines crossed, equal number of men and women. Now I have classes where I have only women. I have to look for a young man in my class. So it's just, again, it's like that aging and the younger graphs, the same thing's happening with men and women. And so we tracked it for the UNC system, for the predominantly white institutions, for the HBCUs, and for the minority serving institutions. That'd be like UNC Pembroke. So we looked at it, and look at the small number of men in the UNC system schools, and it just gets smaller as you get to the HBCUs. So when I was there 50-50, at UNC, it's now 40% men. So we're losing young men in college. And we looked at this a couple of different ways just to see what was happening, however you slice it. And when you get to graduation as well, more women graduating from college, and really men at those HBCUs really struggling. So not that this affects your workforce here in terms of what the workforce looks like, Male population labor force change, kind of a mixed bag, but it's basically been declining. And you see the older generations are the men who are holding down the fort in the labor force. And those younger ages, they're disappearing from the labor force. When we look at dependency, we look a lot at grandparents that are raising kids, skips in generations. So we looked at youth dependence, old age dependence, total dependence, because we want to look and see, like, especially women, millennial women who have children they're caring for, as well as parents they're caring for. We're certainly not in the same situation as China with the 421, but going forward, we certainly could be with the decline in the number of children and then the number of elderly individuals in a family that they're taking care of. So that's a lot of stuff that's going on. So declining labor force participation is a huge impact. That number of foreign-born population has started slowing down, probably have some changes coming, may slow down. Deaths of despair, opioid addiction, still pretty high, declining fertility, and the white population's declining. So when you mix all that together, we call those some real challenges for the workforce, but also where we live, who we relate to, and how people feel like they're belonging. If the composition, ethnicity-wise, is changing so dramatically, how do you think about ways to make people feel like they belong? Because we just don't look the same, and we're not the same age as we used to be. So that kind of takes us to the iceberg scheme, which is you go in a room, I can tell if you're like me by race, ethnicity, gender, all those things I can see about people in this room, but then there's the things I can't see. Who's lost 5 people in their family in the past 3 years? Who speaks 10 languages? There's all these things about us that we can't see below the iceberg. So what we try to do in the business school and with companies is encourage them to create spaces where people go below the iceberg to find ways that they can belong and relate to each other, whether it's in a living situation like this, whether it's in a neighborhood or a classroom or a workforce. So really what the iceberg demographic scheme is all about is looking below the surface, forgetting the color, and focusing on those traits that we have in common below that iceberg. So to that end, this is kind of to tell you a lot of things you already knew, that what's going on in the population, but what we're here to do is to take this information. Again, we're going to give it to you so you can watch it, look at the slides, know a little bit about what's changing, but then talk to you in focus groups, get some information from you on a survey, have you tell us what you think about what's going on, and then help make some recommendations for what this community looks like going forward, and with the change in the population, how you adapt and relate to those changes.